The committee will come to order. The Oversight and Government Reform Committee exists to secure two fundamental principles. First, Americans have a right to know that the money government takes involuntarily from them is well spent. And second, Americans deserve an efficient, effective government that works for them. Our duty on the Oversight and Government Reform Committee is to, in fact, protect these rights. Our solemn responsibility is to hold government accountable to taxpayers, because taxpayers have a right to know that the money government takes from them is well spent. It is our job to work tirelessly in partnership with citizen watchdogs to deliver the facts to the American people and bring genuine reform to the Federal bureaucracy. 3.5 years ago, closer to 4, in a partisan vote, the House of Representatives passed the Patient Protection Affordable Care Act, commonly referred to as ObamaCare. The Act gave this administration more than 3 years to implement. It gave them virtually unlimited money. It ensured them that for all practical purposes they need not come back to Congress ever again, because they created an entitlement, one that raised its own money, spent its own money, created its own rules. The 2,400 pages that were passed into law and then read afterwards now represent tens of thousands of pages of regulations that were created by this administration based on how this administration wanted a law interpreted, meaning that legislation created 3.5 years ago was still being written in late September. The cornerstone of the President's signature achievement included a website, HealthCare.gov. This site and parallel sites created by some states were supposed to make it easy to have an online marketplace. It was, in fact, an attempt to duplicate what hundreds, perhaps thousands, of insurance companies, large and small, around America do well every day. On October 1st, President Obama said using it would be as easy as buying an airline ticket on Kayak.com or buying a television on Amazon. This is an insult to Amazon and Kayak. On the day of the launch, President Obama should have known the harsh lesson we have all learned since that time, and that was they weren't ready. They weren't close to ready. This wasn't a small mistake. This wasn't a scaling mistake. This was a monumental mistake to go live and effectively explode on the launch pad. For American people, ObamaCare is no longer an abstraction, and it is a lot more than a website. For millions of Americans, it's about losing insurance the President promised you can keep, period. For many Americans, it's about premiums going up when you were promised they would go down by $2,500. Big businesses lobbied and received an ObamaCare waiver this year. However, the individual, the taxpayer, the citizen, the only real recipient of health care did not. Individuals still have to pay a penalty if they don't have insurance that meets a Federal standard, a standard of what your government, your nanny state, believes, in fact, you must have. The penalty is still in effect, and even if new exchanges don't function. The penalty is in effect even if you planned on keeping the health care you wanted, period, and discovered it is now gone, or have yet to discover, because ultimately if you are on an employer plan, you may not yet have found out that your employer either cannot afford or cannot receive the health care you have grown accustomed to. The specific reason we are here today is a narrow part of this committee's oversight and legislative authority. It is, in fact, to examine the failures of what should have been an IT success story. Nearly $600 million, 3.5 years, is larger than Kayak ever dreamed of having to set up their websites. It's larger than eBay spent in the first many years of a much more complex site that auctions in real time millions and millions of products a year. We're here to examine a failure of technology, not because the technology was so new and innovative, not because this was a moonshot, not because we needed Lockheed Martin and Rockwell to come in and invent some new way to propel a ship to the moon, but because we have discovered, and will undoubtedly continue to discover, that efforts were taken to cut corners to meet political deadlines at the end, that for political reasons rules were not created in a timely fashion, that in fact the rules that should have been created at the time of the passage of the law or shortly thereafter, in many cases, were still being given to programmers in September of this year. Now, I recognize that there are divisions on this committee, as there were when Obamacare became law. Many members, including myself, believe that there was and is a health care crisis in America. It's a crisis of affordability. And insurance is simply a way to score what that affordability is, not to drive down the cost. Many members, including myself, opposed this new law because we thought it wouldn't work and it had no systems to actually reduce the cost of health care from the provider. My friends on the other side may correctly note, as I will here, that many Americans are benefiting from Obamacare. At the cost of trillions of dollars over a 10-year period, I certainly hope so. But divisions over whether or not taxpayer money taken and pushed back out to needy who are trying to afford health care is not the subject today. Unfortunately, during the first 2 years of the Obamacare law under Speaker Pelosi, there was no effective oversight. Oversight was shut down during the first 2 years of the Obama administration, and the minority pointing out anything was ignored. Under my chairman, we have tried to correct that, but we have been disappointed by continued obstruction by the minority on this committee, defending the administration even when it has failed to deliver the relevant documents and they find themselves objecting to hearings, witness requests, and constantly engage in petty downplaying of what in fact are a serious problem. The minority today will undoubtedly point out that this must be political, that we are not here because only 1,100 people at a time could get onto a website before it crashed effectively, when 250,000 needed to get on it because it was a law and they were mandated. We are not here for that reason, the minority will say. We are here because this is political. This committee, on a bipartisan basis, has offered legislation that if the Senate had taken it up and the President has supported and signed it, and it had been implemented in this project, undoubtedly many of the mistakes made we would find would not be made. In fact, the lack of budget authority for a single point on a project of this sort, conducted and overseen by somebody who had a success story in similar operations, rising to the level of a $600 million multi-committee, multi-state website, if that person had been there and in charge, I have no doubt that person would not be with us today because that site would be up and running. On October 10th, I joined with Senator Lamar Alexander, a member of the minority in the Senate who finds himself unable to get answers, asking Secretary Sebelius to provide documents related to HealthCare.gov. Unfortunately, on October 28, a month into Obamacare, I was forced to issue a subpoena because of a lack of response from the administration. To date, HHS has not produced a single responsive document to this committee. In contrast, the committee has received far more cooperation, transparency, and document production, receiving over 100,000 relevant documents from the private sector, from contractors working on this project, the very contractors who were blamed on day one as their fault, not a single political appointee's fault, not Obama's fault. I know the ranking member and I could fill an entire hearing with discussions about our differences, and I have no doubt, in short order, he will air many of them. But for this hearing, I think we can find agreement. The agreement would be simple. Whether you like Obamacare or not, taxpayer dollars were wasted, precious time was wasted, the American people's promise of Obamacare, in fact, does not exist today in a meaningful way because best practices, established best practices of our government were not used in this case. Now, our government must quickly grasp the lessons of what happened here in Obamacare's HealthCare.gov project to better and more effectively implement underlying policy changes so this won't happen again. The investigations of this committee have received testimony and have paid documents indicating many problems that led to the disastrous failure to launch on October 1st. The committee has learned that numerous missed deadlines and ignoring of integrated security testing requirements are still a problem for this system. The ranking member gave to me, and I will put it in the record, a letter very concerned that some of the documents we received from contractors, if they got in public hands, would be a roadmap to the security flaws that exist in Obamacare's website today. It is our committee's decision that those documents will not be released, that we will carefully ensure that any material given to us by anyone that would help hackers discover more quickly the flaws in Obamacare's website are not made public. But let us understand, the ranking member's statement in that letter says more than I could say, and that is, on the day of the launch, and even today, there are material failures in the security of the Obamacare website, meaning that even though we may not put out the roadmap, hackers, if they can get on a website that only accommodates 1,100 people at a time, hackers, in fact, may have already or may soon find those vulnerabilities. They may soon find your Social Security number or your sensitive information because there was no integrated security testing before the launch. And MITRE Corporation and others pointed this out in time for the launch to not have occurred until security concerns were properly vetted. The last known security test conducted by the records we've been given, and again, given by contractors because the Administration has failed to be in any way honest or transparent in producing documents, show that in mid-September, at least as to the Federal Marketplace segment of the site, they identified significant findings of risk. Documents from the contractor MITRE identified a chaotic testing environment. According to Mr. Henry Chow, the top operational officer for the Marketplace Administration, delays in issuing regulations created a compressed time frame for building the IT infrastructure. We know, for example, that HHS did not issue any regulations in the 3 months prior to November 2012 election. Yes, I am saying that it seems sad that you pass a law in the first few months of an administration, and yet it seems that regulations came to a halt so they would not be out there in the marketplace during the President's re-elect. 2 years is too long after a law that has mandates before you go and tell the American people and the website producers what they must do. This committee has learned that a complete integrated security testing did not occur. meaning test the pieces but do not test the entire product, was one of the faults at the launch. That heightens the risk of unauthorized access, non-encrypted data, identity theft, and the loss of personal identifiable information. This is not this committee's opinion. This is testimony. The Director of CMS stated he was not even aware of some testing results that showed serious security problems in the weeks before the October 1st launch. He testified that these results should have been shared with him and said the situation was disturbing. HHS offered no further explanation for nearly 2 weeks until after the committee made a redacted version of the key memo public. At a briefing last week, Tony Treckel, CMS Chief Information Officer, told investigators he normally signs the authority to operate memos to launch CMS IT projects. In this case, however, and wisely, he determined that he would not sign the HealthCare.gov document, and in fact required a less qualified and obviously erroneous signature by Marilyn Tavner to occur on that document. Now, that's kicking it upstairs because you know it isn't any good. And although I appreciate a CIO not signing a document for a site that wasn't ready, I think at the same time we must recognize that there should have been public objection to Marilyn Tavner signing that document for a website that clearly was not ready for prime time. Additionally, today we are hearing from a distinguished panel of witnesses, and I recognize that some of the witnesses, particularly Mr. Park, are busy elsewhere trying to get this site operational. But since we have been in the neighborhood of 6 weeks since the launch, I trust that hundreds, or if necessary, thousands of the right people have most of their marching orders, and that in fact it is time for Congress, on any committee of jurisdiction, to look over the shoulder of the Administration to ask both what went wrong, and today not just ask, do you promise on November 30th to make it right, but will you in fact commit to the changes in law that would ensure this doesn't happen again? I don't hold this committee hearing today to sell IT reform. This committee has already done its job to sell IT reform. However, it is essential that you understand that when Mr. Cummings and I make public billions of dollars worth of failed IT programs, the American people often get a small snippet in the newspaper. So today, I think the American people should know this isn't the $600 million unique event. If it were, it would be a different hearing. This is part of a pattern that occurs due to failure to adhere to the private sector's world-class standards for web production. This is a pattern that includes Schedule C political appointees being more involved than career professionals. This is a pattern that has to stop. Our witnesses today, among our witnesses today, will be Mr. Dave Power, a Government Accountability Officer and an expert in fact, what those practices should have been and what failed on HealthCare.gov. I might note for all, he is in fact a career professional, a nonpartisan, and an individual who doesn't work for me, doesn't work for the ranking member, but works for the American people. I will do the rest of my introduction when the time comes. I now will yield to the ranking member.